The organizers, especially Enrico, for inviting me to this event. And I understand this is the kind of introductory lecture for this session. We are 3 minutes behind. And then others continue and deal with some of the issues I tackle relatively superficially in my presentation. This is just to remind you all about the huge diversity of different types of nanomaterials, which clearly is a challenge for risk assessment, risk management, also exposure assessment and hazard assessment of these materials. This cartoon just gives some examples, but there are more than 200,000 different types of engineered nanomaterials synthesized in laboratories, and of those few hundreds of thousands of different materials, maybe less than 200 have some commercial value, increasing though. But to my knowledge, there's not a single engineered nanomaterial which has been studied for exposure and hazard assessment according to the REACH requirements. So in that regard, we miss a lot of knowledge which is required for reliable assessment of risks and of these materials, and also considering their management. Thinking of then exposure, transformation, the life cycle of engineered nanomaterials, this is a nice slide produced by Thomas Kulbusch. Thank for him. He'll allowed to use it. On the left hand side, you can see the perspective from life cycle point of view. You have different stages in which, for example, workers can become exposed to these materials during production, processing, recycling, and then, for example, consumers may become exposed when they deal with products. And then we have recycling when there will maybe releases into the environment, and also workers may become exposed. You may have releases into different environmental compartments like air, soil, and water. The other slide, other picture shows you with this same issue from exposure point of view. You need to have release of some source of these materials, and then you can become exposed via air, via food, via water. And I focus in this presentation on workers and workers' health. So, of course, production stage is the most important, and then perhaps recycling of these materials, and in most cases, inhalation is the most relevant exposure route. But as I mentioned, there's very little data. Considering looking at the issue from risk assessment and risk management point of view. So that's really the challenge, and how to use a limited amount of hazard and exposure data to develop risk management guidance to be used by regulators, industry, and other stakeholders. This violet spot indicates the amount of data we have available today, and then the challenge is how to generalize this limited amount of data to the universe of all types of different engineered nanomaterials. Well, when you think of occupational exposure and then assessing of risks and management of those risks, so obviously you have to identify the types of workplaces where exposure to engineered nanomaterials may take place. And so you have to identify and analyze those places. And this slide is from our paper published in Scandinavian Journal of Work, Environment and Health. And here, what the types of workplaces which have been identified include research labs. Of course, scientists are in the first line, becoming exposed. They are also workers. We have start-up, scale-up operations where exposures can take place. Manufacturing and production in small scale or large scale, incorporation into products, then disposal and end of life, and recycling. In these types of occupations and workplaces, one may become exposed in the occupational environment to these materials. Of course, the key issue is to identify those companies and workplaces where exposure, where these materials are being used, how many workers are working in those workplaces, to which materials they can be exposed, and what might be the exposure levels. I also want to remind you of this, fundamental toxicological equation, hazard times exposure equals risk, because if you want to reduce risk, you can do it either by reducing hazard, by banning or restricting or use of some materials, or then limiting the amount of exposure, in some cases even banning the use of some materials when you can delete the exposure. Inhalation is the main, most important way of exposure in workplaces, and as I mentioned before, we suffer from lack of both exposure and hazard data. We have also, we know from various studies carried out in workplaces that workplace engineered nanomaterial concentration often poorly correlate with job shifts, which is an additional challenge. We don't know well enough the processes which really determine the levels of these materials in workplaces. Another challenge is what exposure metrics predict hazards. We don't have yet the understanding or the association between material characteristics and then which are associated with subsequent hazard. Regarding biological monitoring or using exposure indicators, biological indicators, the challenge is that we don't have nanospecific indicators for the time being for nanomaterials to be especially for hazards. We can, of course, if the levels are high enough, we can measure and engineer nanomaterials in body fluids like urine or blood or saliva and so forth. It's a challenge in some cases for the, say, level of which you can detect level detection, but in most cases not. And then one challenge is that we don't have available to date methodologies which would allow distinction of engineered nanomaterials from nano-sized background. So it's hard, for example, to set occupational exposure limits for different types of workplaces where engineered nanomaterials are being used. I introduced briefly two approaches which are being utilized or proposed for management of risks of engineered nanomaterials. The first one is Provisional Nano-Reference Values proposed as acceptable benchmark values not to be exceeded and based on engineered nanomaterial number concentrations in aerosols. They are not associated or supported by hazard data, so it's difficult to compare these values, for example, with recommended the exposure levels issued by NIOSH, but not implemented. These provisional nano-reference values are not implemented either anywhere, but they've been proposed by the German institutions and also Dutch government. These are policy-driven, pre-cautionary, and not health-based values. These are actually the provisional nano-reference values, which have been widely publicized. So I think you are familiar with these. I just wanted to remind you about this approach. They have been, the materials have been grouped into 4 different major groups, and then there are like group level proposed number concentrations for all these groups. The other approach is the one which is used by US NIOSH. They issue draft recommended exposure limits or REL values. For example, in the case of titanium dioxide, it's 300 micrograms per cubic meter threshold time-weighted average concentration for a full day for a working lifetime. And in this assessment, cancer is the basis of the evaluation. A recommendation is based on mathematical modeling, not used in the EU, and they are based on mass concentrations. So currently we have 2 different approaches to manage exposure to and hazards of engineered nanomaterials. but they are not being implemented. These are proposed approaches. We have these provisional nano-reference values, policy-driven values, and you might say that they are Dutch, German proposed values, but they may, for example, Finland, our institute is implementing the same values in Finland for the time being. But then we have health-based provisional in-house REL values issued by US NIOSH, which are mass-based, contrary to the number concentration used in provisional nano-reference values. My understanding is that for the time being, science does not yet provide an answer on how to assess or regulate exposure and risks of engineered nanomaterials. And we don't know yet associations between materials and characteristics and exposure and hazards to judge which engineered nanomaterial risks might be available. And all these are needed for a working risk assessment concept. So for the time being, we have to consider main issues like importance or severity of the health hazard, quantities of these materials used, their physical form, and duration of exposure when considering the risk management, risk assessment frameworks. Just a kind of summary and snapshot of innovations and regulatory requirements. So far, material characteristics or material bioidentity is relatively poorly understood, but at the same time we need to regulate, or regulators need to regulate the use of materials and exposure levels. At least they need to do this in the near future. Thinking of exposure assessment, the challenge is what are the right metrics to be followed. They also need to be regulated, but it's very hard when we don't have the data to provide the firm foundation for this activity. Considering that exposure data should actually be in a position to predict risks, so that we know that when we reduce exposure based on given metrics, we know that we also reduce the level of risks. So, but at the same time, I would like to emphasize that there's a need to use what we already have to protect the workers. And at the end of this slide, I would like to emphasize that regarding risk assessment and risk management, we should try to find new ways of thinking and to be able to provide a foundation for a qualitative leap and getting perhaps further away from the currently used risk assessment paradigms to come up with a new one. But this is for the future. So, in brief, concluding, responsible management and innovations that enable use of engineered nanomaterials. I think safety by design or safer by design approach promotion is important among industries because safety equals trust, which equals acceptance of new technologies, which is important for the success of these materials and technologies. We have to keep in mind that safety assurance requires resources and commitment of all stakeholders, academia, regulators, and industry. So it's important, for example, to see what comes out from decisions related to Horizon 2020. And in this final slide, I would like to emphasize that the important issue in all undertakings related to improved hazard assessment and exposure assessment and ultimate risk assessment, it's about reduction of uncertainties around safety and health issues around engineered nanomaterials. And when we can do it, so we can support safe utilization of engineered nanomaterials. Thank you for your attention.
Thank you very much, Kai. There is time for a couple of questions just for the talk, on the talk. At the end of the session, if we will have some few minutes, we can address also general discussion. So please. I have just one short question. There is the possibility to now to perform exposure assessment with personal devices, so to assess the workers' exposure, or there are not so reliable the devices or the...
Yeah, well, brief answer. I think we have lots of devices to reliably assess, the number concentration or mass or surface area, a number of other things, zeta potential and so forth. The challenge is that we do not know which one of these is the right one to be followed. So, I mean, we can accurately, reliably measure exposure by using a number of different metrics, but we don't know which one of those metrics is the right one or which has the potential to predict the risks. So that's it. We have the technical capabilities to do all kinds of things, but we lack some fundamental understanding. So that's my view.
Okay, thank you very much. A short question? Yeah.
Thank you very much for your talk. I'm just wondering about the medical applications, and I'm wondering what you would consider to be the most poignant risk and hazard from the medical application point of view. So if you're talking about MRI uses or injectables.
Well, I was focusing on like inhalation exposure, which is kind of goes outside the medical application field. When you inject something, so it's totally different ballpark, and of course, you work under different, say, EU processes under EMEA, and drugs are carefully controlled by European Medicinal Agency and so forth. So I kind of excluded nanomedicine outside this presentation. Of course, it's possible that and workers in drug industry, they may be exposed to these materials when they are being produced in drug houses and so forth. But, well, this is about what I can say. It may not be so relevant to your question, but that the connection to me in this context with development of nano-based drugs.
Okay.